All right. Well, I want to say good afternoon, everyone. My name is Sean Connely. I am the Associate Director of Graduate Admissions here at Bentley University. Welcome to our information session, which will be all about the Bentley University Healthcare MBA. I am thrilled to be joined by Dr. Iris Berdrow. Dr. Berdrow is the Program Director for the MBA program and especially this Healthcare MBA as well. She'll be doing a deep dive into the program while I will go over the admissions part of things and answer other questions as well. If you do have questions throughout, please feel free to use that question and answer box. We will be answering questions throughout, and we'll do a little bit of answering some questions at the end as well. So without further ado, I will hand it over to Iris to talk about the Healthcare MBA.
Thanks, Sean, and welcome everybody. Really exciting to be talking to you about the Healthcare MBA. So as Sean said, I am the MBA director here. I'm a faculty member in the management department, and I have been part of this Healthcare MBA since its first conversations and all the way through the design and implementation and now delivery of it for several years. So I'm really excited to be talking to you about it. So as you see on the screen, there's a number of questions, and one or more of them may be similar to things that you've experienced, probably resonates with you. Now, healthcare is a really tumultuous, continually evolving sector, defined by challenges in government regulations, continuous diffusion of clinical innovation, and the ethical imperative to deliver extraordinary medical care in a fiscally sustainable organization. So given these complexities, Bentley has created a cohort-based MBA offering to ensure healthcare leaders are really well prepared to meet these continued challenges. And not to be too elementary, but before we dive into Bentley's program, I wanted to take just a minute to describe what an MBA is. A master's in business administration is meant to help you understand how businesses work as systems of individuals interacting with each other. A participant in our program described this in a slightly different way. This learner said that she enrolled in this program because she wanted to understand why certain decisions were being made at her hospital, and then she wanted to understand what she could do to improve the situation and how she could help make her hospital thrive. So Bentley believes in business for good. An MBA program is more than just a credential. It's really a transformative experience that equips professionals with the tools to navigate an increasingly complex and uncertain world. Rapid shifts in economic, social, and regulatory environments demand leaders who can interpret uncertainty, anticipate challenges, and drive meaningful change. Through a deep understanding of human relations, organizational dynamics, and economic and political forces, an MBA fosters the ability to make strategic decisions in high-stakes situations. So I'll spend our time today describing these 4 program features. I'm sure you'll have questions about the features that I don't cover. If you take away nothing else from today's conversation, I hope you will remember that we want to get to know you and support you throughout your individualized application process. So let me talk first about Bentley and what we bring in terms of the expertise and relationships. Actually, Sean, can you go back one? Thank you. Um, you know, Bentley really has a strong bench strength in business, but also in healthcare and the sciences. And I'll talk a little bit more about our centers in a minute. Because of that, we really infuse healthcare into every course throughout this program, through cases, projects, examples, and we bring together a cohort of like-minded learners from the healthcare industry because learning is really a social phenomenon. You learn from your peers as much as you learn from the materials and your instructors. And we've built a program, as we'll talk about, that really fits into your busy life so that you can do this online in the evenings and still have your professional responsibilities met as well as your personal ones. Thanks, Sean. Now we could go to the next one. So I want to tell you about two professors that teach in the healthcare MBA. They're really extraordinary examples of Bentley's depth of knowledge in the business of healthcare. Fred Ledley is a physician, educator, and entrepreneur. He's the director of the Center for Integration of Science and Industry. He's a recognized opinion leader in the integration of basic science with medicine, business, society, and education, with research ranging from biotechnology, business, and finance to molecular human biology, drug development, bioethics, and STEM education. And he teaches our healthcare innovations course. Ben Chartok is an economist who has studied various topics related to U.S. healthcare, including price transparency. He was recently awarded $250,000 by Patients' Rights Advocate for the development and publication of research addressing lowering healthcare costs and ensuring price transparency. And he teaches the microeconomics foundations of healthcare. Both are affiliates of Bentley's Center for Health and Business, which is comprised of over 90, yes, I said 90, faculty and staff members at Bentley. The center brings in extraordinary speakers throughout the year, and just recently hosted an over 250-person global summit centered on the integration of AI into healthcare. So we bring this collective knowledge to the Healthcare MBA, which has been specifically designed in conjunction with a major healthcare provider in our region. So one of the features I noted earlier is that the program is infused with healthcare examples. Unlike some healthcare programs where healthcare electives are added to core courses that are not healthcare specific, we crafted a program in which all courses have healthcare running throughout. I will note that this is an MBA program, and the tools and lessons can be applied to any industry. But this degree is tailored to highlight healthcare examples, cases, and projects so that you can see how business questions are playing out in your industry. The Healthcare MBA curriculum is comprised of 12 to 15 courses that fall into three distinct types: foundational courses, core courses, and electives. Foundational courses ensure that all learners have a baseline understanding in really fundamental business topics. Students may be granted waivers for foundational courses given strong academic and professional background in the subject areas, but most students in the healthcare program take all 5. They are offered in a pattern that allows students to easily transition into the program. Foundational courses include the microeconomics of healthcare and accounting for decision making, but wait, don't run away. I've spoken to many of the students in the program, and they often cite these courses as the most transformational. A hospital site director shared that the accounting class, which she was most wary of initially, completely changed the way that she runs her weekly finance meetings and really empowered her to have more meaningful conversations with her sites. Core courses are required for each MBA candidate to successfully complete their MBA, as these are considered essential for business mastery. Example courses include Leading Responsibly and Law, Ethics, and Social Responsibility. In one of these courses called Designing for the Value Chain, a group of students did a group project surrounding interpreters at various hospital sites. That project is transformed into a working group at the hospital system, and there is now a proposal for how to expand the number of available interpreters. Electives in this program were designed specifically to meet the needs of healthcare leaders, as defined by a major hospital network. The 4 electives are interpersonal dynamics in healthcare, project management for healthcare, healthcare innovations, and healthcare analytics. Now, I want to talk to you a little bit about how you will learn. Our courses are designed, as I said, to fit into your busy working schedule. At any given time, you should expect to take 2 courses. Typically, there are 2 course types paired together. One that is completed online, live on Zoom, with your fellow cohort mates, and one that is completed online on your own time. The course online meets one night per week for either 2.5 or 3.5 hours. And for each class, you should expect about 10 to 12 hours of classwork per week. This includes class sessions, readings, assignments, etc. So some of you might be wondering how you're going to be able to fit this into your work and personal obligations. We've heard from both current students and alums that it is absolutely possible with purposeful planning. We've had learners from all phases of their career, from entry-level employees to executives, and at all life stages, including parents. We have even had at least one student have a child during the program. I'm not saying this balance is easy, but everyone has been able to successfully navigate the program. Another major feature of how you'll learn is who you learn alongside. As I said, this is a cohort program, meaning you will take all of your coursework with the same group of learners. Those learners intersect with the healthcare industry. Many work at hospitals in varying roles, so you'll speak a common healthcare language, but will learn how different areas of the industry work. You'll be on teams that cut across roles. Your learning will be meaningfully influenced by the relationships you form and the network you create. So at this point, I'm going to pass it back to Sean to talk about the admissions requirements.
Wonderful. Thank you, Iris, and thank you all again for being here as we discuss this fantastic program. Again, my name is Sean Connely. I'm the Associate Director of Graduate Admissions here at Bentley, and I oversee the MBA portfolio in the admissions office. So when your application comes in, me and my team work with your application to make sure you have everything you need and also be a support for you. So right off the bat, what is it that we need for your application? And ultimately, we need your transcripts. Pretty much every transcript in terms of your institution that you've been to. So whether you have an undergraduate degree or even a graduate degree, another type of master's, any transcript that you have, we would like to see it. So you want to get those in. We do require an up-to-date resume, as well as one letter of recommendation and one essay. The essay is prompted on the application. So you'll just answer the question that is given to you on the application. You will see there that we are test optional when it comes to the GRE or GMAT, but we do get the question of, is it worth taking, or even handing it in if it's optional. Also, does it hurt my chances if I don't send it? We are truly optional. If you choose not to submit the scores, we do not look into that. But if you do submit them, it can help in regards to not only your application, but even more so as you go through this process. So it is optional, but do know that we do accept them. And it is something that if you feel that you need to enhance your application, it is encouraged. So definitely something to take a look at. What I would tell you is that if you have any additional questions regarding the application or things that you need, or if you want to have a further discussion, and you'll see here at the bottom of the screen, you'll see my contact information. Please feel free to do so. We do one-on-one consultations. Happy to have a conversation with you in regards to your current status, what you're currently looking for in your MBA, and then go over all these documents in regards to what you need to submit. Much information is available with the portal. So once you start the process, there is a portal that you will have all this information, but always feel free that you can use me as a resource and a guide in terms of this process. So in terms of upcoming dates, the final application deadline is August 1st of this upcoming, of this year. We are releasing decisions 2 weeks after the completed application. So once your application is complete, we do have a 2-week turnaround in terms of getting you a decision in regards to your application. And that means all documents, not just when your application is submitted, but once we get all of your documents, once that final document comes in, then it's about a 2-week turnaround until we get you a decision. And classes will begin September of 2025. So it's coming up soon. It's May 7th today, and I feel like it'll be September tomorrow. So, but there is still time to apply if you are looking for the fall. There is still time to get everything in. So at this time, I do want to open up to any questions. And I know, Iris, you get this question right off the bat. It's one of the first things you get asked is, why was this program created?
Sure. It was actually a really exciting opportunity. One of the major hospitals in the area was looking to partner for a specific healthcare MBA. And Bentley has a really unique structure and resources that allow us to deliver an integrated healthcare MBA. And so we were obviously an applicant to that call, and we were the winners of it. So we developed the program for a major healthcare hospital network in the region, and have since spread this out more broadly in offering the healthcare MBA to a wider network. But we are very excited to be at the front line of this. Obviously, we are in a very rich healthcare ecosystem. We are also in a very competitive academic area. But as I said, Bentley has real resources and the capability to bring that healthcare perspective and the sciences into the business classrooms and integrate that curriculum.
Is there a specific, because this is a unique program in regards to not everybody in healthcare is a business person.
Correct.
And in this program in the past, we've had physicians, we've had doctors. Who is the type of person that should be, or who would be good for this program?
Sure. So clinicians, physicians, administrators, staff people who want to do one of several things. One is advance your career, move up the career ladder, expand out into new areas of your industry, and to really do more within the area that you're in currently. So take on more meaningful projects, take on team leadership, be more effective. It's really anybody who wants to improve their own and their organization's performance. And to do that, you really have to understand how the entire organization functions, so that you can see how, from your level and area within the organization, how you can influence that change positively. And as you see the picture on the screen, this is our first graduating cohort, and they really, as each consecutive cohort represents, they're really a broad range of roles within the healthcare industry.
Iris, you and I have talked many times about the MBA program, and I always find it fascinating. One of the things you always say is the MBA is the most important one that you use daily. What is it about the MBA for you that makes it that way?
Yeah, sure. Thanks, Sean. So the reference is, I have 4 degrees. The MBA is not the last one, but it's the one that I use every single day, because as I lead teams, as I work with teams of faculty and administrators and staff people across different divisions within the university, we all have different perspectives. And so one of the things that I need to be able to do is to map out who the stakeholders are and understand what their objectives are, even though they're different than my own objectives. When I run programs, I need to understand the cost implications. I need to understand how to do budgeting. I need to understand how to do basic tracking of expenses. As we think about rolling out new programs or increasing the the stretch of our marketing. We have to understand, how do we brand our product? We're selling a product, and how do we brand that to different industries? All of those things come from an MBA.
And I will say one of the key things you brought up earlier was about foundation courses and waivers. And for those that are curious about this, there are opportunities to waive those foundation courses, but it's based on if you had taken the course in the past. It's so for given, example would be, we have a foundation course in economics. If in the last 5 years you've taken microeconomics and macroeconomics and did well, we can waive that so that you're not repeating and having to do that course. But we do cap it at 5 years because we do feel that the industry is always changing, and so there's always something new, and we're and making sure that you're up to date on that information. So there is an opportunity to waive. But do know that that is taken into consideration when your application comes in. That is something that nothing in addition that you need to do. It's something that we will take a look at your credentials, and we will make the decision on that for you.
And if I can just,
go ahead.
if I can just add to that, Sean, people ask, well, I don't know what economics is all about. Like, well, that's the purpose of the foundation courses,
Yep.
right? Or you may not have any idea about accounting or finance, and numbers aren't your thing. That's the intent of these foundation courses, to give you the language and the basic understanding of what is that tool and how do I understand it, so that when I'm talking to somebody from purchasing or from budgeting, that I know what they're talking about. I may not necessarily be able to do their job, but at least I know how to talk to them about what they're concerned about.
Absolutely. Absolutely. And while we wait to see if you do have any other questions, you can use the question and answer box to ask them, and we'll talk about them. And while we are waiting, just a reminder that we are still accepting applications for this upcoming fall. So if you are interested, you can get your application in as soon as possible. And again, it's a 2-week turnaround. I also would suggest that if you are interested in learning more and sharing about your story or experience or what you're looking for, you can reach out to me again, and I will actually put my email in the chat as well. You can email me directly, and we can set up a time to talk one-on-one. Now, we do have, I know that we do have another session coming up next week. Iris, do you want to share a little bit more about what is going to be happening next Wednesday?
Yeah, there is a mock class given by Ben Chartok, who I spoke about earlier, our economist. And this is a really exciting opportunity to get a peek into what this whole learning environment looks like. We assume that for most of you, it's maybe been a while since you've been in a formal education setting, and it may not have been in a business setting. And so the way that we approach learning and teaching in a business setting is different than in a medical or a research setting. So we're giving you a peek into what it looks like inside a classroom by one of our stars, Ben Chartok, and really encourage people to attend that and just see what does it look like. One of the other things that I'll mention is, people are often concerned, how am I actually going to be able to do this, given that I've got a full-time job, I've maybe got a family, I, like to take care of myself and spend some time. How do I fit, an extra 20 hours a week for classes and coursework and everything else? As I said, it is possible. Picture shows that it does work, but it does take planning. And one of the things that I always encourage people to do, or two of the things actually, one is develop a schedule, a really clear schedule that includes study time, and be honest about that. If it's Sunday afternoon when the family is off doing something else, and you miss out on maybe some family events, but you spend that time on your coursework. I had a friend of mine once who had two small children. She was going through a pretty intense program, and she used to put a picture of herself on her office door at home. And she'd tell the kids, look, when the door's closed, that picture of mommy is about all you get of mommy during that time, right? And you actually have to do those kinds of things. And you have to negotiate with your family and friends and bring them into your support network. You'd be surprised how supportive the people are around you and how willing they are to help you out, knowing that it's less than 3 years. And at the end, you have something that you can really leverage for the rest of your life. This is an investment into your career for the rest of your life that you and all of those around you will benefit from. So really take it in that vein. And one last example, at this first graduation party, at the end of each cohort after graduation, we have a celebration for that cohort, which is where this picture came from. And I was speaking to one of the dads of one of our graduates, or a husband of one of our graduates, and he had brought his two small kids. And so I was talking to the kids and I said, are you really happy that mommy's finished the program? And they said, yeah, dad's a really bad cook and we need mom back. So the family kicks in and helps out.
Oh, that's great. And I know we've had some of these alumni back talking about their experiences and stuff like that. So they've been wonderful, and it's been a beneficial program for them. At this point, we don't have any other questions. Iris, do you just want to close out by any kind of final advice, any final thoughts?
Yeah, I would really encourage you, if you're entirely committed to this, this is what you want to do, get your application in, get started. If you have questions, reach out to Sean or Emma or myself. And if you're really uncertain about how this is going to fit in, talk to your network, figure out why this is of interest to you, and see how you can make this happen. But would love to see you on the roster in the fall.
Absolutely. And yeah, just a quick email away and we can walk you through this process. I know everyone, is eager to assist if needed. So if there are other questions, happy to help out along there. So I want to thank everybody for joining. Thank you, Iris, for sharing the information. Again, let us know, and hopefully we'll see you next week for the mock class. And have a great rest of your day and a great rest of your week.
Thanks, everybody. Thanks, Sean.